Hey, lovely. It's really nice to see so many people joining us today. So, yes, welcome and thank you for joining us. Just a little bit of housekeeping to start, as ever. The chat function is open, so you can feel free to pop any questions in there, and there'll be opportunity to ask any questions at the end. Today, we're going to talk about what's considered to be not only a very difficult topic for some, but also what can be seen as quite a controversial subject. So, any of you who have either have or do experience issues with persistent pain, or know friends or family members who suffer from barriers or restrictions as a consequence of ongoing pain and associated symptoms, will appreciate how varied and intermittent the care and support that people can receive is throughout the UK. So what we would like to do today is share some advice and support with you to help you to understand your symptoms and also help you to understand those who are experiencing these difficulties. So first of all, who are we? I'm Claire Glynn. I'm the Clinical Operations Director for PAM Physio Solutions, part of PAM Occupational Health. I am a physio by background and I've worked in occupational health for over 14 years. I have a specialist interest in ergonomics and the efficiency of activity performance and movement. And then that stems into the acknowledgement of barriers to activity efficiency and lifestyle and movement behaviours. And all of these can be contributing factors to poor quality of life and persistent pain if they're not considered properly by a healthcare professional. Today I'm delighted to have Luke with me today. So Luke, would you like to introduce yourself to our audience?
Yeah, so my name's Luke. I'm an operations lead within PAM. I've worked in occupational health for nearly 10 years now, having a specialist interest in, funnily enough, people struggling with chronic pain conditions and trying to help people to return to normal and understand the wider impacts of that on themselves. And so we can address as many different factors as we can. So hopefully I'm looking forward to sharing some of my experiences with you today.
I think something's just gone a little bit right. Just bear with me 2 seconds.
I think that pain is such a fascinating topic, and there's so many different things that contribute towards it. So we're really looking forward to passing on some of that information today, and hopefully you can get some benefit straight away, but then also understand how that can impact you positively in the long run as well.
Brilliant. Thank you, Luke. Sorry about that. A little bit of an IT hiccup there. I'm not quite sure what I did. Okay, so discussions around persistent pain and ongoing pain and symptoms are not simple. And I think it's fair to say that Luke and I could probably talk about this subject for days. But we've tried to make this webinar a summary of causes and conditions and as an overview, I guess, who we want to be able to support and why. A really important aspect that we want to address today is common misconceptions. And these can and do have really derogatory effects on any individual's quality of life and can be a main part of the failure to have a successful plan of action to overcome pain barriers. So we're going to talk about occupational health support for colleagues who are experiencing persistent pain and also provide you with an overview of what our programme looks like UK-wide. I think even more importantly, second only to addressing common misconceptions, we want to explain some ways that employers can support their colleagues and employees.
So I think for anybody that's ever suffered with a painful condition themselves or had a loved one that's close to them suffer from a chronic pain condition, we can see undoubtedly the impact that it has. And we don't need these statistics to emphasize or show that. But the statistics, despite that, the statistics, if I can speak, do shed a light on the wider impact that it has and just how many people it does impact as well. We can see that 35 to 51% of people in the UK suffer with a painful or chronic pain condition or have done at some point in their life. One of the key factors that influences it as we get older is age, along many different things that we'll come on to discuss later in the webinar. We can see that women are slightly more likely to have chronic pain conditions than men, and I imagine that's for many different reasons. And then there is quite a large cost to society on that, with productivity costs amounting to between 5 and 10 billion pounds. Those statistics are quite outdated now. They're from a few years ago, but we see in the current literature that is quite consistent as we go on. So I think that that's really interesting and quite profound, really, to assess and be aware of those different statistics. Further from that, though, on a more personal level, these statistics don't really mean that much. I think what people who suffer with pain can really struggle with is a significant loss of self. They can start to not enjoy hobbies that were once enjoyable. They might really love their job, but rather than being able to focus on their job and personal and career development, they have to kind of plan and project how the pain might impact the career. Hobbies that once were enjoyable, they might enjoy to play five-a-side or go to the gym or do Pilates, no longer are as enjoyable because they're now tainted and associated with flare-ups that they might have had in the past. And that can muddy the waters and make social involvement, psychological well-being and physical well-being really difficult. I sometimes analogize this as a bit of a snowball effect, where it affects one thing and then it picks up and it affects the next thing and the next thing, having kind of eating up and having an impact on an individual's whole self and whole being and whole nature of their life, which can be really difficult to then address as a healthcare practitioner, but also to live with as an individual.
Thanks, Luke. So, this here, different conditions and causes, it's not an exhaustive register of labels. Some people may have come across or be aware of some of these, but I guess this is a limited catalogue of what you may understand as chronic pain. And I use the word chronic very disdainfully, as that word in itself has extremely negative connotations around it that we as healthcare professionals have tried to move away from using. It implies that there's no room for improvement and there's no possibility for resolution. Now, all of these diagnoses that you can see here and all of these experiences have very unique presentations for every single person who experiences them. And a lot of the time what happens is that a person receives their diagnosis and they may know someone else who has the same diagnosis, or they may Google that diagnosis, and they immediately establish their own barriers, whether consciously or subconsciously, and a downward spiral initiates. We know that in support of these types of conditions, there's a bit of a postcode lottery in terms of both availability and quality. And what we want to do about that is make the support available, including the correct education, time, space, groups, and give people with these unique experiences the capacity to learn about what is happening within their bodies, with their own biology, and how to work with and overcome their symptoms to have a good, if not great, quality of life and not be restricted by their symptoms and their experience. Luke, I know you've got a really especially keen interest in the causes of persistent pain and the conditions and background of the development of symptoms associated with these persistent conditions, haven't you?
Yeah, absolutely. And I think it's one of those things where the more that you research about, the more that you realize that you don't know. And it is such a complex region in terms of talking about causes. And I think that in the literature and from my anecdotal experience as well, of speaking to people with painful conditions, the more that you realize, and I don't know if you think this as well, Claire, or are aware of this, there is no one cause why somebody would develop a persistent problem, why somebody would. It sometimes seems very unfair. Some people get an episode of back pain and in 3 days it goes away, whereas other people get exactly the same episode of back pain and 4 years later they're still having very significant problems with it. And that can be very complicated and very difficult to address and also to live with for that individual. And I think that sometimes, similar to what you were saying, with it becoming more and more complex, the more that the painful condition can persist, sometimes the more we can look for that single solution to try and help, the more that we say, oh, let's try a massage, let's try to ice it, let's try this particular medication. And then when those individual single problem solving solutions don't work, we can feel really down and really helpless. And that's where potentially having some intervention that understands the wider causes and the wider effects of pain can be really useful.
Yeah, thank you. I think what we're very much getting to the crux of there, and we'll talk about this in a few slides time, is that the causes of persistent conditions is multifactorial. So the solution has to be multifactorial as well.
Absolutely. And then this is another thing that finds really interesting, and especially with anybody, with just being humans, we are going to develop our own thoughts and our own conclusions of what's going on, and these can lead to some common misconceptions. And we can see some of the quotes on the slide here. I'll never be pain-free again. I'm broken. I'm not able to take part in hobbies because I'm off work. Pain is the first and last thing I feel each day. Being independent is a thing of the past. My pain makes me feel lazy. My pain will only get worse. No one else feels the way that I do. I can't be a good partner when I feel like this. Medication is the only way of treating my pain. I'm ready for the scrap heap. Because I have pain, there must be something seriously wrong. And just from those select few of quotations that you might have said yourself, or you might believe yourself, you might have heard certain family members say, we can see the multifactorial or the widespread impact that pain can have on individuals. These don't just encompass the actual sensation of the pain itself and how troubling that is. It also encompasses the wider impact that pain can have, how it can really take away your sense of self.
Perfect. Thank you, Luke. So what can we do to help? What can occupational health do to support all of this complexity and these underlying biopsychosocial barriers that are far more difficult to overcome than simply stretching a muscle or a tendon or healing a bone and helping it to heal up? The principal statement to make is that we understand, and we want you to also understand. We want people to know their bodies, what makes their symptoms better, what makes them worse, what can be improved upon, what can be overcome or reduced in terms of symptoms and physical capacity for activity. And we want to set people on a positive journey. Our aim as a healthcare professional with a specialist interest in this kind of area is to improve quality of life, activity performance, and the long-term ongoing ability for an individual to overcome their barriers and understand what they can do about anything that they come across. We provide tools, techniques, education, knowledge and outcome measures so that each participant has the capacity for long-term self-help. We recognise that an individual with persistent pain issues cannot necessarily be cured. We're not necessarily looking for a resolution to what is going on. What we're looking is being able to help people have the quality of life despite their diagnosis, despite their pain, excuse me, and reduce that pain experience. The pain is real, the pain is there. What the cause is so complex, but that doesn't mean we can't have really positive impacts. So what does our programme look like? We have built a unique programme that is very bespoke and contains modules, as you were. And we help people through that biopsychosocial journey of recognizing what it is that they're experiencing and why they're experiencing it, what tools they've got available to them, and how they can implement those tools. And we support people in the implementation of those tools. So we run a 3-month program, and it's a one-to-one program. It is delivered remotely as well, so it is really highly accessible across the UK. And they're usually fortnightly sessions, so there is quite a bit of flexibility in that depending on the individual's requirements and needs. Some people may need intervention and discussions more frequently. Some may need longer to be able to adjust and perform the lifestyle changes that are needed. But the message is that it's all nice and bespoke to any individual that accesses the service. So when someone accesses the service, we can do that through referrals from a manager. We can do that through accessing it through one of our other services in occupational health and through our Physio Solutions app as well. And what I want to get across here is the fact that the modules that we look at over the course of these 6 sessions are quite complex, and it's tough and it's hard and there's homework to be done. So we look at neuroscience, which is all about pain and how pain is generated and how symptoms are experienced, what the biology of the body is doing, what the psychology of the body is doing, and how the sociology of the body is actually being impacted there as well. And that's key to any education and understanding for someone who is experiencing these symptoms, because how and why you're experiencing them and what the body is reacting and what it's doing is so important. It's your body, you know, you need to know what it's doing and how it's functioning and why you experience what you experience. Then we have a look at behaviour change, and this is probably the hardest module, which is why it's quite early on, because individuals who are experiencing their pain, especially an individual who's potentially been experiencing this for a really long time. I know I speak to people who've, you know, had a diagnosis of fibromyalgia maybe 12, 15 years ago, and they've been medicated and they've just been taught to get on with it. And that's what they're doing, they're getting on with it. But if we can implement elements of behaviour change to help people not experience the down days that they experience and not have the pain because they had a good day, so they've done boom and bust activities, for example, or they're considering, I know Luke, you said one the other day, didn't you, where an individual might win a free holiday to Disney, and it's actually their worst nightmare because all they can think is how busy Disney's going to be and how that they can't walk for that long and how it's going to have a negative impact on their overall health and experience. And we want to be able to help people get excited about going to Disney on a free holiday. We can all dream, can't we? But that behaviour change is a big part of people doing their self-help strategies, and we want to be a part of helping people recognise what parts of their behaviour and lifestyle they can change. Pacing and goal setting is a huge part. I mentioned boom and bust before, but what we've got to do is set realistic goals and understand what an individual wants to get out of accessing this program. Where do you want to be in 6 weeks? Where do you want to be in 3 months? Where do you want to be in 3 years? What do we need to do to help you get there? And a big part of that is pacing and learning what your limitations are, recognizing those, establishing those, and then growing on them and improving them and increasing them. We look at the effects of stress and how that affects your symptoms as well, because everyone knows that if you're stressed, you're not sleeping right, and recovery happens far better in sleep, and effectively therefore look at sleep, nutrition and exercise. Being musculoskeletal clinicians, we are absolutely biased towards the exercise prescription side of things, but an individual who's been experiencing pain for a long time and feels the limitations of exercise needs to gradually and incrementally be increased, and that releases endorphins, which also helps with pain reduction, and that is a proven fact. So that just gives that broad overview of what it is that we would want to deliver to individuals and how we would want to support people experiencing symptoms. And as I said, this is such an important topic to talk around, and that's how employers can support employees. So an employer could be an individual who experiences pain. An employer could be someone who knows that they've got a population of their colleagues who experience pain. And if employers don't understand what persistent pain is and how it's affecting their workforce or any of their individual unique employees, then how can they support? So we are here to provide that advice. We are here to help educate everyone involved. And what we want to do is sort of open that door, that it's not taboo to ask about an individual who's experiencing chronic pain and conditions. You can ask us questions about that. It's unique. It's not the same as someone injuring themselves last week playing rugby. It's far more complex than that, and we want to help you understand that. So we want to support the employers seeking advice, and equally we want to support you in allowing your employees to seek advice. We go back to that individual who was diagnosed 15 years ago and has just been getting on with it. We're in a different world now. There's more research, as Luke said, there's more literature. So we have answers now. We have more answers and we have better answers, and we want people to come to us and ask those questions and tell us their experience. We like to avoid derogatory language. I mentioned before about the fact that I don't like the word chronic, and I'm sure Luke would agree with me, and hopefully the rest of our team would agree as well, because of the negative connotations that come around it. And I know we've spoken, haven't we, Luke, previously about derogatory language, and It's things like my back is crumbling and it'll never be the same again, and all those quotes that Luke discussed in an earlier slide, where people have these myths and misconceptions. Unfortunately, we want to absolutely myth bust that and help people have a positive experience. We will always be encouraging activity, physical activity and exercise. As I said, we're completely biased against this, but it is absolutely true that physical activity is a winner. Employers need to be approachable. And if someone is experiencing difficulties or problems, or is feeling as though they are having barriers to successful work or activities outside of work, they need to be able to discuss that with someone within the workplace. And as I said, the education and training, people understanding what's going on and how it works is key to that openness and transparency within a workplace. And having that means that there's no, I guess, hidden agendas, and it means that people can seek that support and that healthcare professionalism that we can help to provide as healthcare professionals ourselves.
So I understand there's a lot of information that's been transferred there in a relatively short period of time. So just while you digest all of that information, I'd like to just offer the opportunity to either unmute yourself and speak, or to use the chat function to ask any questions that you might have of Claire and I. We'll give you a few moments just to think of any questions that you might have. Some questions might encompass further about the program itself and any questions that you've got about particular time frames or outcomes that you might expect as a result of this service, how we would go about achieving them, and a sample or an example of how we could do that. So yeah, we'll just give you a few moments to consider any questions that you might want to ask, and I think Claire's got a few more slides that she wants to go through while we're doing that.
So in the meantime, while you're all hopefully thinking up some really good questions for us to challenge us, I'd like to share this slide with you, which I think which is a link to our website, and this holds a plethora of downloadable resources, blogs, videos, useful guides and leaflets and booklets, podcasts, and it also exhibits our service provision. So please do feel free to have a look at that. And these slides also will be shared with everyone that's joined today, so you can have a look afterwards too. And then just going to take the opportunity to put Luke in there. Luke will be leading a webinar on the 14th of October, time as you can see here. This links in well with part of what we have spoken about today in common misconceptions and myth busting, and is another really important topic to be addressed for any individual's recovery from any condition or situation, even if it isn't musculoskeletal. And while we'll just get some more questions through, I've just popped up a final slide that invites you to join our mailing list if you haven't already. This allows you to receive all our latest news and updates and invites to free events and webinars. And again, a nice volume of supporting material to help you with your health and well-being and to support your colleagues and workforces. So let's just have a quick look through, see what we've got, Luke.
So we've got two questions in. Thank you very much for that. So Amanda has asked a question: do I have to attend MSK Physio before I could ask my line manager to refer me for the 12-week course?
No, is the short answer. So you're a Solihull MBC, so this is I know you have an on-site provision there, don't you, Amanda? And if you have been attending there, that's fine. This service is a specialist service that you can ask your manager to refer you into. There's a triage piece that occurs beforehand where you'll have a conversation with an experienced specialist clinician who'll be able to have ask where you're up to, what your experience is, so we can build the course around you, so that we make sure we get exactly the right thing. But no, you don't have to have attended that clinic beforehand.
Yeah, and just to piggyback off the back of Claire's answer there, I wouldn't be put off from engaging in a specialist treatment if you haven't had more standard physiotherapy in the past, because it's not going to make any difference in your engagement in this program. We'll give you all of the tools that you need. There won't be an expectancy of having tried treatment in the past, and I wouldn't expect that to impact your outcome.
Thank you, Luke.
No problem at all. And then the other question is from Tracy. Would someone potentially need longer than 12 weeks, and what outcomes would you expect? So I think that
Ooh.
that's a really good question to ask, actually, because I think I sometimes use an analogy with some of my patients where I'll say that that pain sometimes can be a bit like a watch kettle, where the longer that we look at the pain itself, the longer it'll take. And I think that sometimes part of the treatment that Claire was touching on earlier is actually asking, why do you want your pain to be reduced? And I think that can be a really powerful question, because we saw with a lot of the common misconception quotes, the pain is only one part. The actual intensity of the symptoms itself is only one part of why somebody wants to get better. Even though they might say, why do you want to engage physio? So that I'm pain free. That being pain free holds a lot of connotations. I want to be pain free so I can run again. I want to be pain free so I can lift my children. I want to be pain free so that I can go to Disneyland Paris with my kids. And I think that holds a lot of power. I think a lot of the process of this recovery is going to be focusing on the whys, of actually drilling down for you as an individual. Why is it important to have a reduced level of pain? Why is it important to try and be, why is it important to feel like yourself again? And that's what hopefully we can help you with. That may take longer than 12 weeks, but what we hope to do is to give you the tools so that you can manage that yourself even beyond the program, so that you don't have to have the support of a clinician. There's actually a really powerful term in the literature called self-efficacy, and that essentially means your ability to just rumble on and manage it. And that's what we hope to derive and build within you as an individual, to be able to do the things that you enjoy, to understand your condition fully, and to do what you want to do with your life, even beyond the course of treatment.
Perfect. Thank you, Luke. We have had a few more questions coming in as well. So we'll go, but Amanda popped a second one up. So is this something that SMBC support, or is there a cost to myself? So to you, Amanda, if you wanted to self-fund, you absolutely could, but I would engage in that conversation with your employer about contacting ourselves about engaging in it, because it is an occupational health service and you do have access to occupational health services. And then Christine has asked, in constant muscle pain when moving, however the medics cannot diagnose the condition, how can I cope? The beauty of this course and these interventions and these tools and techniques that we implement and support an individual with is that the diagnosis almost becomes irrelevant. There doesn't have to be a diagnosis. As I explained, I guess, in the earlier slides, those labels are not exhaustive. Some people do not have a diagnosis. Some people will not get a diagnosis because people are struggling to understand, because the tests all come back negative. And what we're looking is at you as a person, not the diagnosis. What is your unique experience? How can we help you? And that's what we're looking to do. We're looking to look at you as an individual, not as a label, not as a diagnosis. So it doesn't matter that you haven't got a diagnosis. We can still help you.
Absolutely. I wouldn't, just because you don't have a diagnosis, it doesn't make your experience any less real. I think is the key. No matter what the cause of pain, all of the other influences, one thing that we're not saying is that pain isn't real. And I think that Claire will definitely share this with me. The longer that symptoms go on, the less it falls into a specific diagnosis or a pigeonhole. And that is not uncommon for it not to be a specific thing or a specific condition, or it to be a little bit of this and a little bit of that. In terms of coping with muscle pain, it's hard to give exact advice without knowing your specific symptoms. What I would invoke, or something that I try and tell people to do, is to try to find a position that's comfortable for you, and to explore different positions, different movements. But hopefully, with some medical intervention, we can kind of help you along that journey. I don't know if there's anything else that you'd add to that, Claire, on a more personal level.
No, I think you hit the nail on the head. Said that, pain is real. It is there. and it's our job as the health professional to help people to overcome the barriers as a consequence of that pain, and the things that we can do to help reduce and manage that pain is vitally important, but the diagnosis becomes almost irrelevant. At the moment, we've just got one final one at the moment. I would like to access this course. This is Rebecca. Am I correct in thinking I just need to email my manager to start it? Yeah, that's certainly a starting point, and then your manager can approach us about accessing the course. That's not an issue at all. We'll be able to provide any details to approved referring managers. So there's no more questions just popping in at the minute. We have still got a bit of time. I'm just going to go through to the last slide. We do have contact details just there popping up, and please do feel free to provide feedback on the slide today. You will be receiving the recording and the deck, and it'll be published for you to access. So if you have missed any of the links or any of the points of discussion, you will have access to that as well. Luke and I will hang around for a little bit longer, easily at least another 10-15 minutes. So if anyone does want to hang around, they're more than welcome to. Oh, one last one. We'll be receiving an invite for the course on the 14th of October. Yes, as part of this, you'll receive the link through to the one on the 14th of October as well.
Yeah.
But thank you everybody for joining us. It's been a delight. I hope we've not scared anybody, and I hope you've appreciated and understood what we've been talking about in a difficult topic today.
Yeah, in summary, I think it's really important to emphasize that you're not alone in suffering with a persistent pain condition. It's not your fault why this has persisted, but that doesn't mean that you're weak. It doesn't mean that you're not going to get any better. Sometimes it's just having the right set of skills and the right environment to prosper and to get better. And I'm very confident that that's what we can provide.
I just had another final question there, Elizabeth. What's the process for a manager to contact you to gain access to the course? Oh, that email address that's right there on that page. So you can pop an email to there, and the client services team will get in touch